Hi, welcome. Perimenopause and postmenopause can affect every inch of the body, but in this video, I'm going to focus on the mouth. There are 7 oral symptoms that can occur at any stage in your menopausal transition. But before I talk about them, I just want to remind you, there are several reasons for any symptom. Menopause is simply one. Please contact your doctor if you have any concerns. The first oral symptom is the main cause of many of the other mouth-related issues. So let's start with dry mouth. Low estrogen causes dryness all over the body. I'm sure many of you are experiencing that unfortunate discomfort. The mouth, unfortunately, is no exception. Low estrogen affects saliva production, which causes the mucous membranes in the mouth to become thinner and drier, leading to other oral issues that are very common in midlife. Let's talk about the weirdest one first, burning mouth syndrome. I deal with this one and it's no joke, let me tell you. As the name suggests, it causes burning and tingling in the mouth, on the lips and tongue, and sometimes in the throat. It can also cause a strange metallic taste in the mouth and food sensitivities. I started noticing burning in my mouth when I ate certain foods, like citrus and mango. And I always thought there was blood in my mouth because of a strange metallic taste, but I could never find a cause for either one. It completely freaked me out until I discovered what was going on. There are several things that help me. Perhaps they'll help some of you too. 1, I always have water on hand and I sip it throughout the day. 2, I try to avoid reactive foods, coffee, alcohol, and super spicy foods. And 3, I try to reduce stress and anxiety wherever I can, because apparently there's a link between burning mouth syndrome and stress. And I figure it can't hurt, right? Next is sore throat and trouble swallowing. You don't know how many times I thought I was getting sick because of a sore throat, but an illness never materialized. Or the fear of having trouble swallowing. No doctor could ever give me a diagnosis for either issue. I eventually discovered, on my own, that perimenopause was the likely culprit. I'm still dealing with these issues now in postmenopause. And if I'm being honest, the swallowing thing still makes me a bit anxious. Dry mouth and lack of saliva can cause soreness and make it difficult to swallow. And because there is not enough saliva to wash food down properly, it can even cause you to feel like you have a giant lump in your throat. That's a fun experience. Taking steps to ameliorate dry mouth can help, although I've never been able to entirely cure myself of these particular discomforts. Next is tooth pain and sensitivity. I have been to the dentist so many times to have my teeth checked due to pain, and they never find anything wrong with them. Dry mouth, bone loss, and receding gums can be potential causes for this mysterious discomfort. Whatever the cause is, it's frustrating and upsetting. I think I've tried every single sensitivity toothpaste on the market. Altered taste can also develop in menopause. Saliva plays an important role in stimulating the taste buds, so when shifting hormones affect the amount of saliva, food can start tasting weird. Foods I always loved taste horrible to me now, so apparently I'm affected by this strange symptom as well. Chewing gum to stimulate saliva production, avoiding foods that dry out the mouth like caffeine, drinking plenty of fluids throughout the day, and trying artificial saliva lozenges and sprays can help. An increase in gum disease and tooth decay is also a possibility. Dry mouth in menopause increases the risk for both gum issues and cavities. Saliva helps wash away germs and bacteria, protecting the teeth. Not producing enough saliva leaves the teeth vulnerable to damage. I've noticed that I'm having to have my fillings replaced much more frequently now, and I've dealt with a few small areas of decay in the last few years when I never had any dental issues in the past. I really have to keep up with my dental hygiene now in order to avoid problems and keep my mouth healthy and happy. Geographical tongue can also appear in menopause. There are several things that can cause this in both perimenopause and postmenopause, such as stress, allergies, and hormonal imbalances causing vitamin and nutritional deficiencies. It's an inflammatory process that causes the loss of tiny hair-like projections on the tongue called papillae. It's not dangerous and usually resolves over time. Body-wide dryness caused by decreasing hormones sure causes a whole lot of problems, including in the mouth. Which oral symptoms are you struggling with? Share in the comments. I also want to let you know that I have a menopause support group if you're interested in connecting and chatting with other menopausal women. We would love to have you in our little community. The link to that support group is in the description beneath this video. I wish you all health, happiness, and peace of body and mind, and I will see you all in the next video. Bye for now.